Hi, everybody. We're live already, but at 1 we're gonna start. My name is Vanessa with AFSC's US-Mexico border program based in San Diego. And in a few minutes, I'm gonna start talking a little bit about a recent report we released this week that focused on excuse me, on ICE detention during the pandemic. We'll give it a few minutes to see if people log on. We just say that we were going to start at 1. We're a little early. We wanted to give ample time for folks to log in and get settled, to start thinking about the questions they're going to ask. So we'll see here. And as you tune in, if you can put in the chat where it is that you're joining us from, that'd be great. Okay, hi. So if anybody's tuning in, we're going to start in a few minutes, just waiting for people to log in. We will be sharing some findings from a report that we released earlier this week, along with some of our partners, Pueblos Sin Fronteras, the Detention Resistance Collective. We're just going to go over some findings. I'm going to share some migrant testimonies. And yeah, we're just going to chat, and then whoever is tuning in, if you all have questions at the end, you'll be able to kind of put them in the chat, and then we can see, I'll see if I can answer them. So again, if you're tuning in, if you want to put in the chat where you are joining us from, just kind of give it a few minutes here. All right, let's see. We have, okay, so I see we have a few people that have tuned in. So I will go ahead and start, right? So again, my name is Vanessa Ceceña. I am the Human Rights Program Associate at AFSC's US-Mexico Border Program, and we are located in San Diego. And we do a little bit of everything, which I will share right now. So again, if anybody, or I see there's, let's see, around 20-ish people that have logged in. If you all want to comment where you're from, if you have any questions or whatnot, just please feel free to put those in the chat. So to make this conversation, I think, a little bit easier for everybody, I am going to share a PowerPoint with some visuals, and then after I will stop sharing my screen, and then we can start answering some of the questions that y'all may have. So just give me 1 second. I'm going to pull up this PowerPoint. All right, I think it's up. Okay, so as I was mentioning, you all are tuning in because we recently released a report that focuses on what detention has looked like during the pandemic, specifically here in San Diego. And so we looked specifically, even more specifically, at what was happening inside the Otay Mesa Detention Center, which is an ICE facility, but it's they contract with CoreCivic, which is a private detention company. So that's kind of the makeup of that detention center. And that detention center is actually just a few minutes from the border. So it also really ties into kind of how we look at or think of border enforcement and border militarization. You know, ICE detention and ICE prisons and jails, concentration camps, you know, the different words that we have for all of these. They're all part of this enforcement landscape that we're seeing all throughout the country, but especially in the border. So for those of you that might not be as familiar with AFSC's work here in San Diego, here's just a very quick overview of what we do. We do engage in policy impact and advocacy. We do base building and alliance building. We really try to make sure that all of our work really is in accompaniment and in alignment with what impacted community members think. And we during all of these processes, whether it's writing reports or working on different policy focuses, we always make sure that we engage those that are directly impacted and make sure that we're getting feedback from them, etc. And then our office also focuses on documenting human and civil rights violations, which is actually what my work primarily focuses on. So as I was mentioning, on Monday, we released this report entitled Compounding Suffering During a Pandemic, a case study in ICE's detention failures. And this was in collaboration with our partners, Detention Resistance and Pueblos Sin Fronteras. And what we did was during this pandemic, so the last few months, we collectively went over migrant testimonies that both Detention Resistance and Pueblos Sin Fronteras and our office, had collected, and this was through phone calls that migrants had been doing from the detention center to one of our partner orgs, or maybe it was through reading letters that migrants had wrote to whichever one of the organizations. So we spent some time really, reading through everything, listening to the recorded testimonies, which PSFN, Detention Resistance, have always done an amazing job at documenting some of the phone conversations that they have been having with migrants. So we reviewed everything, and through that, we kind of laid everything out, and we took a step back and we said, okay, what are the patterns, what are the trends, and what is not being put out already via the media or whatnot. So that's kind of like the thinking that went into planning for this report and preparing for it. So I do want to just pause there really quick and just ask everybody to take a step back and really think about, what does ICE detention or immigration detention mean in this country, and how many people are really being impacted? So based on the government or ICE's statistics or their own data, in fiscal year 2019, there were on average 48,850 migrants detained on average per month. And that is across the US, over 200 immigrant prisons. And so if we break that down furthermore, we're seeing that most people were staying in detention for an average of 36 days. But then if we looked at what was happening here locally in San Diego at the Otay Mesa Detention Center, we were seeing that migrants were being detained on average for 87 days, which is a lot longer than the national average. And the report findings, and this is, there was so much that there was not enough space, I would say, for us to properly, share all of the testimonies. So here's just like a snapshot of what we were seeing, right? So if you all have a chance to look at the report, you'll see that we kind of broke it down in this way. So we were seeing across the board, this is what we were, across the board, I mean, based on testimonies that we were hearing from men, women, some trans migrants, but also from people that are detained at the Otay Mesa Detention Center that are not ICE detainees. That detention center specifically also holds or detains people under U.S. Marshal custody. So all of the folks that we spoke to, or that our partners spoke to, were more or less saying some version of everything you all are seeing on the screen. So we definitely saw that there were issues with testing. So at one point, folks were being asked to self-administer COVID tests, which for lots of reasons, and y'all can read those details in the report, that's very problematic, right? We also saw that there was a lack of access to healthy food. So folks were saying that they were being given 3 cold meals. Sometimes they were given a warm meal, and the cold meals consisted of a bologna sandwich that was just, bread and the piece of meat. And some migrants did share that the meat was even moldy, or it just was not edible. And then we were also hearing that, people that did have dietary restrictions that were linked to health issues, they weren't getting the proper food accommodations, which, can be very problematic. And then we also heard that there was a lot of medical neglect, and this was, all along the spectrum, right? It was people were being ignored when they were, maybe starting to show symptoms of COVID, which could be, they were having, was it cold-like or flu-like symptoms, maybe a stuffy nose, the cough, everything that we're hearing right from the CDC when they were, checking in with themselves and with their bodies, and they were starting to recognize that they maybe were starting to show symptoms. We were hearing that as folks were asking for medical assistance, they were just being ignored, and they were being told that they should just make sure to wash their hands and to gargle salt water. And that's very problematic for many reasons, right? But we also found out that folks had to purchase their own soap. The facility apparently only provides enough soap for 1 week, which is about 1 bar of soap. So a lot of the guidance that whether it was core civic guards or ICE officers that were giving this guidance, the guidance being of, well, don't worry about it, just go wash your hands. We saw that that was a bit, it's pretty hypocritical if people don't have, and contradictory if people can't have access to soap, right? And there's, again, a lot more of that in the report. And then we also heard, just ongoing cases of use of force or threat of use for force, and retaliation. So that I'll just share one specific example of retaliation. We were hearing that at one point, one of the pods, pods are what they call the units or the cells that migrants in these prisons have to, that's where they sleep, in the pods. Anyways, we were hearing that sometimes, some of them had to make their own masks because they weren't being given masks in the beginning of the pandemic. And when they started doing that, they started ripping up the uniform that they were wearing, like the sleeve part, and making masks out of that. And court came back and said, you guys can't do that because you are destroying federal property. And then at one point, one of the female pods, they were threatened with pepper spray because they were substance and ICE were giving them. And then in the report, we also highlight some other information or other testimonies tied to the death of Carlos Escobar Mejia. and he was from El Salvador, and unfortunately, did he did pass during the pandemic while he was detained. And it was just gross medical negligence. So we were able to capture some testimonies that his friends, were able to share with us specifically about what happened, leading up to his complications. And then something that we also included in the report was, the new challenges that supporting migrants during a global pandemic brought forth specifically for our partners, Pueblos Sin Fronteras and Detention Resistance. And I'm sure this is applicable to some of the challenges that other organizations that provide similar support in other detention centers outside of San Diego, right? So we were seeing that across the board, in-person visitations were postponed or limited in the beginning and still now to this day in some cases. Some advocacy organizations that provide support to folks detained, they were targeted and their phone numbers were blocked, meaning that migrants at OMDC, for example, could not contact any of these organizations to ask for support, to ask for commissary funds so they can buy soap or extra food, or to share, about a violation of their human rights that was happening. So that in itself was very problematic because we cannot, it's very difficult to hold CoreCivic and the government accountable if we don't have access to finding out exactly what is happening in detention. And then we saw that what we call post-release services, which means picking up migrants after they're released from ICE custody and making sure that they can get to the airport or to the Greyhound station, to their loved ones, or whatever that may be, right? It changes depending on their specific needs, but our partners had to think through how do they continue providing that very important support, while also thinking through how they can protect themselves and their volunteers, and also the migrants, right? We don't want to re-expose anyone, right? But especially those that are the most quote unquote vulnerable. So our partners had to think through how to host migrants in hotels and what was the best way to do that, and how do you fund all of that. And also one of the detention resistance volunteers, Ellie, he shared that that at one point, they found ways to COVID proof their cars by putting plastic on the seats and shields, very similar to how Lyft and drivers do it, I'm sure. So it might seem like something very simple, but for these for advocacy organizations that are really working nonstop, answering phones from migrants, reaching out to their family members, seeing if they, making links to legal support organizations, and they really have this laundry list of different ways that they're supporting folks in detention, but then having to then think through these things in the midst of a pandemic, in the midst of really finding ways to advocate for more people to be released from detention. These were just these were challenges for them that, for lots of different reasons, they hadn't foreseen or we hadn't foreseen in the past. But something I would say one of the biggest challenges, and this was something that we heard constantly from migrants themselves, but then also from our partners, was that there really was a lack of sponsors. And that, when I say sponsors, I'm talking about folks that that can vouch essentially for migrants in detention and could provide them with housing. So because there aren't enough people to quote unquote sponsor migrants, that meant that a lot of them unfortunately have ended up detained for a lot longer than they should have. And that's just obviously very, very challenging, very heartbreaking. And now I wanted to just really highlight and pull up on the screen some of the, excuse me, some of the testimonies that we displayed and highlighted in our report. And here's one, and I do want to read it, read portions of it, I should say. And this was from a mother detained, and this testimony was obtained by Adriana from our office. She did an amazing job at collecting different letters from women detained. And this migrant was shared, she said, it's very downgrading as a human being. It breaks my heart to go through this situation, especially being taken away from my home and separated from my family. What hurts the most is my 11-year-old son, who is now depressed and needs to see a psychologist due to our separation. And she ends by saying, I can't wait for this nightmare to end. I don't know if my life will ever be the same. And I want to really emphasize that last sentence. I don't know if my life will ever be the same. Because, I mean, in doing this work daily and, this type of documentation work, especially the way I think that AFSC and our partners do this is that for us, analyzing policies and analyzing what's happening in detention, it boils down to this, right? To the human level. How are migrants being, emotionally impacted? And how are they being potentially traumatized, right? Or re-traumatized in many situations by what ICE is doing, by what Core Civic is doing, by what our government is doing. And here's two more. One of them, and these were actually collected by Pueblos Sin Fronteras, PSF. One said, we don't have the care we need. We don't have masks. We have to rip up shirts to make some. And they said we were going to pay for ripping them. So that's what I was talking about earlier about Core Civic telling them that they were destroying federal property. So this is a migrant chiming in about that. And another one shared with us that having to deal with being humiliated by the nurses who treat us poorly for the simple fact of being undocumented. This was very, so he had a situation with some of the medical staff, and we can clearly, read in between the lines, right, that encounter, as brief as it might have been, was very impactful to this person. And when we collect, or actually as you all read through the report, and I really hope that you all do take a few minutes to kind of read through it or at least skim through it, you'll see that at the end we included this quote. It's super powerful. It really stood out to me, and we reviewed hundreds of testimonies from migrants. But this person said, and I'll just kind of jump to the middle of the quote, how many people have to die after him? And the him, he was referring to Señor Carlos Escobar Mejia. Like, when will they start doing something to correct the situation here? How many more people have to get sick? And how many more people have to end up dying before they actually do something and correct the mistake? And we know that the they, right, refers to our government, to ICE, to the entire detention industrial complex, to Core Civic and GEO and the many other private corporations that run these facilities, and also to those that are in positions of power. How many more testimonies do we have to collect and share? How many more reports similar to this? We're not the only ones that document what's going on in detention, but how much longer do we have to do this in order for those that do have the ability to change policies, to defund DHS and to abolish ICE? What else do we have to do to make that happen? And in our report, we do conclude at the end with recommendations, again, that the three of our organizations collectively put together. And we are asking for ICE transfers to stop, for people to be released from detention, for arrests in communities by ICE and also Border Patrol, but primarily by ICE, needs to stop, especially during a global pandemic. And ICE and CoreCivic need and must be held accountable for failing to grossly protect the lives of so many migrants. And up until now, nationally, we have at least 20 deaths at the hands of ICE just this year. And again, as always, we are pushing for for ICE to be abolished, and for that system to completely be re-envisioned, right, and reimagined to really reflect the needs, the wants, and the visions of border communities, of impacted individuals, and of migrants. And now leave that here. This is actually, I want to highlight this image, and it was taken by Pedro Rios from our office. And at one point, Pueblos Sin Fronteras organized a vigil at the detention center, Otay Mesa Detention Center, and we had a vigil for Senor Carlos after his passing, and PSF was able to project a picture of him. It was a really nice way to commemorate his life and his passing, in community with everybody that was present. So I'm going to stop the presentation there, but I really do want to encourage people to put in their questions in the chat, and then I'll see if I can answer them. And if you can see in the, let's see, in the comments, there are links to resources, and also links to our partner organizations. Okay, so I'm gonna kind of do this backwards because I wasn't able to see all of your comments in the chat, and I do see that we do have people from Boston, from Portland, from Philly. I was able to meet Tanya yesterday. Hello. Eric, John, we have Gloria from New York. We have Andy, a good friend from San Diego. Beth. Oh, okay, I'm glad. I'm glad people were able to tune in. But yeah, so I will just want to highlight one of the resources that we did put in the chat, and I actually just liked it right now. There's a lot of information in the report. There's a lot more data and stats that I could have talked about today, but I really wanted to really focus on the stories of migrants. Oh, we have Suck from, sorry if I mispronounce your name, but from Philly. But I really just wanted to focus kind of on humanizing the issue of immigration detention right now by highlighting the testimonies. But in the comments, you'll see that we do have a link to ICE's detention management website. And when you go on there, you can actually download the fiscal year 19 ICE statistics, and you can get all of the data in regards to how many people are detained in all of the 200 detention centers throughout the country. So you can easily access that information. If you all access our report, which hopefully you do, and you post on your social media and you share with your contacts and your networks. But once you open the PDF version of the report, you'll see that a lot of the data is hyperlinked, and that will take you to all of the resources. So hopefully that'll be easier to kind of compile all of that information if anybody is doing any research on detention. And again, none of this work would have been, we wouldn't have been able to do this work if we didn't have the great partnerships from Pueblos Sin Fronteras and Detention Resistance. Their websites are in the chat. I do encourage you all to follow them. They, of course, have Instagram and Twitter and Facebook or whatnot, but they're constantly also sharing additional testimonies from folks detained. Yeah, so I guess if there are no questions, I will stop there. And of course, this is going to be recorded. It'll be on AFSC's Facebook. Hopefully, you all will share this. And if you all have any questions after, you can directly message us, or you can email us. Our general program email address is down there somewhere in the comments as well. So yes, thank you so much for tuning in. I know this was brief, but I hope it really gives everybody something to think about in terms of, how to further humanize what the issue of ICE detention, right? And hopefully you all can sign on to our Abolish ICE petition. That's in the comments. It's also on our AFSC website, on our main website. And yes, thank you again for tuning in, and I hope to be able to talk to some of you all virtually soon. Oh, never mind. I take that back. I see that there is one question. Let me see if I can find the question. Maybe Nathaniel can. Oh, there we go. So the question is, how does AFSC San Diego make sure the stories of injustice shared in this report don't get lost, especially when polling elections are taking up so much airtime? And that's actually a really good question. And I would say that we are trying to find better ways to amplify the voices of people that are detained. And this is actually one of the reasons why we did want to move forward with releasing this report, even though so close to the election, knowing that it might get lost, because yeah, this is the best way to do it, right? To compile, or to present, I should say, testimonies alongside with information on ICE policies or ICE procedures or whatnot. But I would say that, this is one way that you all can really help. You can help us out. You can help our partners, PSF and Detention Resistance, out by, sharing with your networks, sharing on your platforms. And we have a Twitter, we have an Instagram, we have a Facebook, AFSC National, right? We have our main AFSC pages. All of our AFSC programs have their own pages that you can follow, and we're all sharing very similar information, right? We're all sharing testimonies in line with our program, with what program focuses on, right? But we're all trying our best, right, to share the realities of what's happening, across the board. But yeah, I will say that we are trying to get creative, and we are trying to find ways to use our Instagram platform a little bit better. We do hope to do a few Instagram lives with our partners during times that are more accessible to folks. And yeah, we hope to be able to do a few more of these. And I'm glad that I'm getting positive feedback on it being like a 30-minute update. So I really appreciate that. But yeah, if there's anything that anybody would like to specifically hear about or learn about, feel free to just shoot us a message, and I'm sure we can collectively put something together. So I will end there because we did go a little bit overboard. Yeah, thank you again. I hope everybody is staying safe, and please share our report. Thank you.